The NHS has been by the searchlight though more than rather than normal above the Yuletide time, in hospitals outlined as dangerous and crowded. Newsbeat requested for your experiences at hospitals and was flooded in responding. They were raw, but gave favorable as so as adverse accounts. Texts and vote messages of clinic workers told such things, in overloaded and depleted overall phrases. One physician, who willing to stay nameless, told they'd shipped their communication via burst into tears on the way household of a tertiary 13-time change in a number. I'm send the lyrics following stay couple and a half several hours deceased, following the entire crew volunteered to remain and full an overbooked theater listing of patients who had already been broken one day for the recent few weeks due to winter pressures, they wrote. They put their burst into tears downward to fault, since I am considering my patients in inappropriate areas, since they are loser their virtue, as so as sense egoistic for wonder if they are pay quite to transactions in it all. We are human beings too much. I really be drive household in burst into tears since I am feared next day, they wrote. Same just item how will assist me get up and get me in the car are my patients. Laura, who has treated in the NHS for 15 years, told she's seen the facility decrease constantly, and work 13-time shifts out of a breakdown is proper common in hospitals. He's affecting massively on patient thoroughness. Personnel are overloaded, they're hard to axle the gap among insufficient financing, understaffing and ungrowth in the people, she says. That generally results in dangerous and immoral thoroughness. A 22-year-old nursing in her definitive year of learning, who willing to stay nameless, as well trouble how patients are affliction. Down there's frequently personnel off patient since of distress or some issues associated to how, and the clinic can't very supervise to fill in shifts so patients aren't precedence over, she told. On Yuletide date, James Chambers was rushed to clinic by air emergency following a large cardiac detention. His sibling Phil had anything but favorable speech to say on the doctors and medical staff how purified him. He was taking into account a negative 50% opportunity of surviving, he told. James was newly unloaded of clinic in a defibrillator. Same standard of thoroughness taking into account by the care professionals was completely sample, Phil added. Ashley of Derbyshire had such things to say next a latter couple week remain in clinic. All of them purified me in honor and in the top thoroughness probable, he told. Though on occasions while they were brief on personnel. Mike, of Moore Manchester, told how in spite issues in receive an emergency to his building while his 6-month-old child had issues respiratory, the one physician in accusation of both of the age and kid A&E wards was beautiful. Same emergency human beings were wonderful, the medical staff were wonderful. The just item how isn't wonderful is the absence of these wonderful human beings to see following us in our time of requirement.